In QHKA, I've participated in 2 categories. In 2019, Excellence in Healthcare Leadership Awards, which as a team we won. And this year, in the category of the Most Innovative Health Facility Project of the Year, which we also won. What motivates me in terms of those 2 participations largely has been that at a personal level, I see a lot that quality in healthcare can do. And so once we begin a discussion around this and to get people to sit at the table and break the silos and discuss the approaches in quality in healthcare, I think then as a system we begin moving forward. So largely that has motivated my participation in these categories. Quality in healthcare, using the analogy of air safety, okay? For example, we are in Nairobi. If I want to travel to, say, Ethiopia, I trust the airline to get me there, okay? And the reason the airline will get me there is that over time they've created a lot of checks and balances, and you see the meticulousness of it that they apply so as to get people safely to their destinations. So then if we apply a similar thinking into healthcare, that of course healthcare by its nature has inherent risks by way of both from the provider angle and from the patient's angle. So then if we begin putting checks that will more or less give us a high chance of success in terms of delivering the patient safely across this journey, then I think that would work best. Think of it in terms of at a granular level and at scale, there's really a case for pushing the agenda of quality in our healthcare system. How providers can achieve the standards of patient safety and quality, I think it's a long journey, and a provider needs to start from somewhere. And therefore, implementing an incremental approach, I think, works best, whereby you have a stepwise methodology. Start from somewhere and then slowly build it up. And the other approach to it is that we need to start a discussion around pay for performance. Essentially, what this means is that providers who are providing good quality services, and this quality being measured by way of scores or whichever metrics is applied, can be incentivized to continue with that project or that approach, because then this shifts our thinking from just volumes to now looking at values. And this has been applied in other countries and has shown an improvement in terms of outcomes. And similarly, providers who are not giving the patient good quality services can actually be penalized. And this has shown to get people to start thinking more about incorporating standards and quality into their services. So largely, I think those 2 approaches, a stepwise methodology to it, and beginning a discussion around pay for performance can actually help drive the quality in healthcare agenda in our setup. Career, it's been a mixed bag, okay. Of course, when you begin thinking about approaches that are more or less instituting change in the way we do things, there's always a natural resistance to change, okay, and that can come in various fronts. So I've experienced that resistance, but you always need to have fortitude, and in applying that fortitude, that's why I'm here today as the Director of Safe Care and Accreditation. So it has really been a growth journey for me, working through the public healthcare system, working through the private healthcare system, the achievements that we achieved as a team, and now being here in Safe Care to try and push the whole agenda about quality in healthcare. I think to me, at a personal level, gives me a lot of happiness and satisfaction. I view this as a journey. Of course, a lot has been done before, but we now have an opportune moment because of the whole discussion around UHC to push the whole standards approaches in terms of quality in healthcare, and break this disconnected approach that is existing. The public sector looking itself as a public sector, the private sector looking at itself as a private sector, because at the end of the day, we are looking at the patient, okay? And there's never a private patient or a public patient. They are all citizens. So if we jointly pursue this agenda, I think we will achieve a lot.